When the Multnomah County Health Department announced that it was going to hand out tinfoil straws and smoking paraphernalia to fentanyl addicts, the outrage came fast and furious.
What it's going to do is encourage people to come to Multnomah County and smoke fentanyl.
And this also coincided with a call to dissolve the city of Portland's financial support for the Joint Office of Homeless Services, which is run by Multnomah County. Portland City Council had considered pulling out before ultimately approving more than $43 million and promising to revisit the relationship in December. Among those calling for Portland to remove itself financially from the joint office, Portland attorney John DiLorenzo of the firm Davis Wright Tremaine. He joins us now via Zoom from his offices in Washington, D.C. And John, thanks for joining Eye on Northwest Politics.
Hi, Ken. How are you?
Doing well, doing well. Why do you think Portland should pull out from the Joint Office of Homeless Services?
Well, they should pull out because the Joint Office of Homeless Services is run by the county. The city of Portland has very little to say about the policy that the Joint Office pursues. And one of the things we discovered during our last case about the sidewalks and people with disabilities is that the county is on a completely different path than the city. In fact, we didn't know whether to laugh or cry when we discovered that it was the county that spent $2 million of taxpayer money to put 20,000 tents and 60,000 tarps onto the sidewalks, which we then had to sue the city to clean up, and that the city was spending $8 million right then and there to try to clean them up. I mean, I likened it to trying to go up the down escalator. You have two forces that are diametrically opposed to one another. This latest episode concerning distribution of tinfoil and straws to enable the smoking of fentanyl by hopelessly drug addicted people. I agree with the mayor. I mean, it's just totally contrary to what the city is trying to accomplish. And so why should the city be spending $40 million a year on that?
This is what the Multnomah County Health Department told our reporter Lisa Balick when she asked why they would give people the means to smoke fentanyl. Take a listen to this.
I think you're focusing a lot on the supplies, and what I'm focusing on is the means to engage people. We've seen a tremendous drop in engagement across our services with the introduction of illicit fentanyl. And so we are adding these supplies as another means to engage people. If we don't engage people, we can't help them at all.
What do you think of that argument?
Well, I don't think much of it, and I'll tell you why. First of all, the county has called this harm reduction. I don't believe in handing out free needles either, but at least you can justify that based on a policy of attempting to prevent the spread of hepatitis A or hepatitis B. You tell me what harm passing out free tinfoil and straws to facilitate the smoking of fentanyl is going to prevent. It has nothing to do with harm reduction. What it has to do with is increasing demand for county services. In other words, having people show up. The real fact is that fewer and fewer drug addicts are showing up to the county offices for free needles because they are no longer utilizing needles to administer fentanyl. They are instead smoking. And so I think what the county just told you was they want to increase the demand for their services. They have fewer and fewer people showing up. Yes, and they want to, quote, engage.
Yes, as a matter of fact, that's the subject of our commentary at the end of this program. Let's talk about the lawsuit. You successfully negotiated a settlement with the city for disabled clients who claim that tents and tarps on sidewalks violate the Americans with Disabilities Act. Now, are you satisfied with the outcome of that settlement?
Well, you know, the city negotiated in good faith. I was very impressed with the position that the mayor and the city council took, and the position that the city attorney's office took. Instead of slugging it out, which we could have done over a 2 to 3 year period in federal court, both parties wanted to problem solve. And, they certainly weren't pushovers. It was tough to negotiate the deal that we negotiated. But I have to tell you, everybody wanted to make the sidewalks available for people with disabilities who just want to live their lives and be productive citizens. Instead, they couldn't as much as buy a tube of toothpaste without having to commingle into the traffic or wheel through filth and debris and then have to try to figure out how to clean up their wheelchairs. So I'm very pleased with the settlement. I think the city is going to operate in good faith. I'm pleased with what the mayor is doing, which is why I was just so outraged when I heard what the county was going to do.
Here's the basic question here. Can we balance public safety and livability with compassion for those people who are experiencing the problem?
Absolutely. And you know, compassion has sort of been lost in this debate, but we are compassionate about the people who are lost on our streets right now. In fact, every one of my clients in the ADA case wanted to make sure that we were advocating compassionate results. But Ken, I have to tell you, I do not regard the county's policy, which allows people to just languish on the streets until they die of overdoses, to be a compassionate strategy. What we need instead is a strategy to protect these people who are currently in their tents from the elements and from crime. I think the city is trying to do that with sanctioned camping areas. I think the city is trying to then use those to introduce people to services. So maybe we can save 10 to 15% of them instead of the county's position, which is, oh, let's wait 5 years, build a whole bunch of $500,000 a unit housing. Hopefully those who survive for the next 5 years can all move into their housing complete with their drug addictions, and everything will be fine. And you know what? Nothing will be fine.
John DiLorenzo, this is an issue that we will be talking about for a long time to come here in the city of Portland. Thank you for joining Eye on Northwest Politics.
Thank you, Ken. I really appreciate having a chance to be on.